Hello, I'm Dr. Seema Reddy, dental surgeon at Akkineni Hospitals. I hope you're doing well. In today's session, I'll walk you through some important points. Do stay with us and note them down.
Hey everyone, and welcome to today's Explainer. Today, we are exploring this absolutely fascinating intersection of human biology and modern engineering. We're talking about the absolute gold standard for tooth replacement, modern dental implants. For decades, a lost tooth basically just meant compromising on comfort. But today, today we have a permanent solution that literally mimics human anatomy. It is a real game changer. Let's get right into it. Okay, let's dive into this. When you lose a tooth, whether that's from decay, a fracture, gum disease, or even trauma, it is completely natural to immediately focus on the cosmetic gap it leaves behind, right? But the real issue isn't what you're seeing in the mirror. We actually need to shift our focus from that visible space down to the hidden biological crisis that's occurring underneath the gums, because the consequences of a missing tooth, they extend way, way beyond just aesthetics. So, to unpack all this, here is our roadmap for today. We'll start with the hidden costs of tooth loss, then look at the anatomy of an implant, compare implants to traditional alternatives, walk through the step-by-step process, and finally, we'll wrap up with candidacy and long-term success.
All right, kicking things off with Section 1, the hidden costs of tooth loss.
Look at this number right here, 25%. When you lose a tooth, the jawbone beneath it actually begins to resorb, or shrink, almost immediately. Why? Because it's no longer getting that constant stimulation from a tooth root. In just the first year alone, roughly 25% of the alveolar bone in that area is lost, and it just keeps shrinking by about 1% every single year after that. Think of a tooth root exactly like the foundation of a house. When you completely pull that foundation out, the ground above it is naturally going to start to cave in. And that collapsing foundation creates a massive biological domino effect across the rest of your mouth. As the jawbone shrinks, those adjacent teeth start to naturally drift and tilt right into the empty space. Then, the opposing tooth, the one right above or below the gap, starts to over-erupt, literally reaching into the void. All of this changing architecture totally alters your bite, which can cause some serious jaw joint problems and a huge drop in chewing efficiency. Eventually, if left unchecked, this bone loss changes your entire facial structure, causing that sunken appearance we often associate with tooth loss. It is a complete biological collapse. Which brings us to Section 2, the anatomy of an implant. Let's look at the structural solution.
A modern dental implant is, essentially, a brilliant piece of three-part engineering. First up, you have the fixture. This is a titanium, or sometimes zirconia, screw that is surgically placed into the jawbone to act as your new artificial root. Second is the abutment. Think of this as the connector piece. It attaches securely to the implant fixture right above the gum line. And third, you have the crown, which is the custom-made zirconia or ceramic visible tooth. The reason this specific assembly is considered the medical gold standard is right here. It uniquely replaces both the visible tooth and the underlying root, the whole shebang.
Moving right along to Section 3, implants versus traditional alternatives. Why are implants actually better?
And this brilliantly illustrates the difference. Let's compare implants to standard dental bridges for a second. To place a traditional bridge, your dentist actually has to grind down your perfectly healthy adjacent teeth just to serve as anchor points. You are literally sacrificing healthy teeth to replace a missing one. Implants, on the other hand, are completely independent. No adjacent teeth are harmed whatsoever. Plus, a bridge just sits on top of the gums, meaning it does absolutely nothing to prevent that 25% bone resorption we just talked about. Implants, they halt bone loss entirely.
Now let's contrast implants with removable dentures. Dentures come with a whole host of frustrating flaws. They require those messy, annoying adhesives. They often loosen up over time, which means a hearty sneeze can honestly be a risky maneuver. And because upper dentures cover the roof of your mouth, they can severely impair your sense of taste and how well you chew. And most importantly, just like bridges, they do not prevent bone loss. Implants, by contrast, are rock solid. They're stable, super comfortable, and they eliminate every single one of those denture drawbacks.
I really want to pause on this quote from our source material because it hits the nail on the head regarding the core physiological reason implants are such a revelation. Bone preservation. This is the most clinically significant advantage of implants. Implants halt this process by transmitting chewing forces directly to the bone. By acting like a real, natural root, every single time you chew, the implant stimulates the jawbone. It keeps that bone tissue alive, healthy, and structurally sound. All right, Section 4, the step-by-step process. Let's demystify this surgical journey. Let's move to and see how this builds across the patient journey. It essentially happens in 4 main stages. Stage 1 is a comprehensive digital assessment using advanced CBCT scans to evaluate your bone density. Stage 2 is the actual surgical placement of the titanium fixture. Stage 3 is osseointegration, which is a healing period of about 8 to 16 weeks. And finally, Stage 4 is your custom crown fitting. Now, Stage 2, the surgical placement, sounds daunting. I want you to consider this. The actual placement procedure usually only takes 30 to 60 minutes per implant. That's it. And it's done right under local anesthesia. A precise drill sequence creates the site, the fixture goes in, and the gum is closed up. Our source material notes that most patients are completely surprised by just how manageable and incredibly fast this part of the process really is. The real magic, though, happens during Stage 3 in a biological process called osseointegration. Let's define this quickly. Osseointegration is the biological process where the titanium implant fixture permanently fuses with the natural human jawbone. Because titanium is so highly biocompatible, your actual bone cells grow right up to and intertwine with the microscopic threads of the screw. I mean, it literally becomes a living part of your human body. How cool is that? It's also definitely worth noting that the timeline we just looked at, well, it can sometimes be accelerated. In very specific cases, if you have adequate bone density and zero infection, you can actually get immediate implants. That means the implant is placed in the exact same appointment that a failing tooth is pulled out. There is also a protocol called same-day teeth or immediate loading. This is often used for full arch restorations like all-on-4 or all-on-6, where a temporary restoration is attached to the implant on the very day of the surgery. Let's jump to Section 5, Candidacy and Long-Term Success. Basically, who qualifies for this? The good news is most adults with good general health are fantastic candidates for this, but there are a few strict requirements to keep in mind. You absolutely must have adequate bone volume and healthy gums, so any active gum disease has to be treated before you even start. Systemic conditions like diabetes, they must be well controlled. Specifically, you're looking for an HbA1c level of under 8%. You also really need to be a non-smoker because smoking significantly impairs that osseointegration process we talked about and drastically increases the risk of the implant failing. And lastly, you need a serious commitment to your oral hygiene. But if you meet those candidacy requirements, the data is just staggering. At the 10-year mark, upper jaw implants boast a 95 to 97% success rate. And for the lower jaw, which naturally has denser bone, well now what's really interesting about this slide is this number right here. An incredible 97 to 99% success rate. Guys, this isn't a temporary fix. With proper care, these are literally designed to last you a lifetime. But notice, I just said with proper care. Once your implant is fully healed, it acts exactly like a natural tooth, which means it requires the exact same maintenance. We're talking brushing twice daily and using implant-specific floss or a water flosser. If you don't do this, you risk something called peri-implantitis. This is a bacterial infection of the tissues around the implant, and it's very similar to standard gum disease. According to the medical data, peri-implantitis caused by inadequate oral hygiene is the absolute leading cause of late implant failure. Basically, take care of it, and it will take care of you. So the crucial point here is this. Losing a tooth isn't just about having a little gap in your smile. It's a massive structural failure that causes your jawbone to shrink and your bite to completely collapse. Dental implants offer a remarkable, scientifically proven way to halt that bone loss, preserve your facial structure, and completely restore your function. We've seen how the titanium integrates directly into your body to recreate a flawless, permanent foundation. So I'll leave you with this final thought. If a missing tooth is a collapsing foundation, are you ready to permanently rebuild yours? Thanks so much for joining me on this explainer today, and I really hope this provided a totally new perspective on the incredible engineering hiding inside your smile. Catch you next time.